Well, regarding the LASIK program at the Yavitz Eye Center, people have asked questions about our equipment, and they want to know why I chose the equipment that we have. And I've given it a lot of thought. For one thing, I'm an inventor. I have 35 United States patents, and several of these inventions regard equipment that we use during the LASIK procedure. For example, I've invented a sponge that keeps the flap of your eye moist on both sides while we're doing the laser. And we're one of the few clinics that have this innovation. The fact that it stays moist means that your visual recovery is a lot faster and more comfortable. Now, we use the Nidec laser, and I've chosen the Nidec laser for two reasons. Number one, we don't have to pay an extra fee to the company that owns the Vizx laser, and that translates into a lower fee for you. And number two, the Nidec laser has been examined and tested alongside the Vizx laser, and the results have been equally good with both lasers. So I'm very confident that this system will give you a great result. Now, people ask about custom ablation. Custom ablation requires a Vizx laser, and what it does is it reduces the ability of the surgeon to make changes for the patient. For example, I may want you to be a little nearsighted so that you can still read at mid-range if you're over 40 years old. And that's something that is not always possible with the custom ablation because they're shooting for 20/20 vision. Now, we can do 20/20 vision for a younger patient, but for someone over 40 who wants to retain the ability to read, you may want to be 20/20 in one eye, but 20/30 or 20/40 in the other eye so that you can still read at a reasonable distance. So this is one of the tricks that we use to satisfy patients who are in the 40 to 50-year-old range or even older. I've done patients as old as 80 with great results with this laser. Now, as far as making the flap, some patients question whether the laser that makes the flap is worth the extra $1,000. And the answer is there is no appreciable difference, even under a microscope, of the flap interface, whether you use the mechanical keratome, which is what we use, or the laser for making the flap. So I've chosen to continue to use the mechanical keratome. The complication rate is no higher, and the results are equally good, and it saves you a lot of money. So it's just it's just not worth the extra expense, in my opinion, and in the opinion of most eye surgeons in this country.